Beginners in Dentistry. Today we are going to see a new topic, epidemiological index. This is an important topic in the subject of public health dentistry, and usually the questions are asked on various indices used in epidemiology. So we will see different epidemiological indices. Before we see the definition of an epidemiological index, we should know what is an epidemiology. The epidemiological studies are carried out to know the disease burden in particular population. Usually the epidemiology is nothing but a study of distribution and determinants of health related states and events, and these epidemiological indices are used to study particular diseases in populations. So we will see the definition of an epidemiological index. It is a numerical value describing the relative status of a population on a graduated scale with definite upper and lower limits, which is designed to permit and facilitate comparison with other populations classified by same criteria and method. This is the definition given by Russell A.L. What are the objectives of an epidemiological index? Measurement of disease incidence and prevalence, to identify populations at high risk and low risk, to define the methods of prevention and control. These are the main objectives of an epidemiological index. What are the ideal requirements of an index? The ideal requirements are clarity, simplicity, objectivity, validity, reliability, quantifiability, sensitivity, and acceptability. The index should be clear, that means the scoring criteria for recording the index should be clearly demarcated for each value of the score, that is the clarity. Simplicity means the index should be simple to record with minimum requirement of instruments. Objectivity is the index should be objective to record the scoring for different individuals. It should be valid, that means it should be validated by all the persons or fraternity in that particular community. Reliability is the reliable index should be reliable and should be easy to understand. Quantifiability is also one of the important ideal requirement of an index. The index should give you value so that you can quantify that index and you can compare the values with the another populations. Then it should be sensitive, that means the index should record the minimum occurrence of the disease in community, and it should be acceptable by all professionals all over the country as well as abroad. Indices are classified broadly under 4 categories depending upon their either the reversibility or the extent of the oral cavity examined or the entities. So we will see one by one what are the different classifications of index. The first one is based on the direction in which the score fluctuates. The indices are classified as reversible index and irreversible index. The index in which the value of the score reverse back to its original value after the removal of cause or after the treatment is called as a reversible index, and the index in which the value of the score does not reverse back to its original normal value even after the removal of cause or the treatment of the disease. The second classification is based on the extent to which the areas of oral cavity are scored. They are classified as full mouth index and simplified index. Full mouth index is an index in which the all the teeth present in oral cavity are examined, and simplified index is the index in which only selected teeth are examined. Third classification is based on the condition of the disease measured. The indices are simple index and cumulative index. Simple index is an index in which only the present condition of the disease is recorded, and the cumulative index is an index in which the present and past condition of the diseases are recorded. The fourth classification is based on the entity which is measured. The indices are disease index, symptom index, and treatment index. The indices can also be categorized depending upon for what purpose these indices are used. They may be classified or grouped as plaque index, gingival index, oral hygiene indices, then different periodontal indices. These are periodontal disease index, Russell's periodontal index, community periodontal index, community periodontal index for treatment needs, then caries indices used for the assessment of caries status of the patient. They are DMFT DMFS index, DEFT DEFS index, root caries index, stones index, caries severity index, Czechoslovakian caries index, caries susceptibility index, DMF surface percentage index, and molars index. Then the indices used for dental fluorosis are Dean's fluorosis index and community fluorosis index. We will now see the plaque index in details. This plaque index was given by Silnes J and Low H in 1964, which was modified in 1967. The modification criteria was that for score 1, the criteria was modified so as to exclude the application of disclosing solution. So previously, when the index was given in 1964, to calculate the score 1, disclosing solution was applied over the tooth surface, but according to the modifications given in 1967, the application of disclosing solution was excluded. This plaque index can be used as a full mouth index or simplified index, but the most commonly we use simplified plaque index in which only the selected teeth are examined. The instruments required for recording this index are mouth mirror and explorer. The teeth examined in simplified version of this index are 16, 12, 24, 36, 32 and 44. These 6 teeth are also called as index teeth. The method of scoring the index. While scoring the index, each index tooth is divided into 4 parts: one complete palatal or lingual surface, and the labial surface is divided into vertical 3 parts: midfacial, mesiofacial and distofacial surface. Scoring criteria for the plaque index is the scores 0, 1, 2 and 3 are given. Score 0 is given when there is no accumulation of plaque over the tooth surface. The plaque is not visible, as well as the plaque cannot be detected by probe or explorer. Score 1 is given when the plaque is not visible, but the plaque can be detected by moving the explorer or probe. Previously, the plaque was visible after the application of disclosing solution, but as per the modified index, This disclosing solution application is excluded. Score 2 is given when directly visible plaque is there, in which there is a moderate accumulation of plaque over the tooth surface. Score 3 is given when there is abundance of plaque over the tooth surface. To calculate the plaque index for each index tooth, we add all the scores of 4 surfaces of each tooth and divide it by 4 so that we get the plaque index for that particular index tooth. In the same manner, the plaque index for each index tooth is calculated for all the 6 index teeth, and then the plaque index for that patient can be calculated by adding the scores of all the 6 index teeth and then dividing it by 6. We get the plaque index for that patient. Depending upon the total score calculated, we can grade the oral hygiene status of the patient. The oral hygiene status of the patient is said to be excellent when the score is 0. When score range is from 0.1 to 0.9, the oral hygiene status is good. Oral hygiene status is fair when the score is in between 1 and 1.9, and when the score is in between 2 and 3, the oral hygiene status is poor. If you like this video and if you found this video helpful, please subscribe.